Welcome to the Radon Information Session for Conception Bay South and St. John's. We are glad that you are joining us this evening. We will do about a half-hour presentation and then have time for questions. So feel free to put questions into the Q&A or in the chat, or if you happen to be watching the recording, you can certainly throw questions into the comments as well, and we will answer those, or we will share our contact information at the end so you can reach out anytime. I will start with some introductions. So we are pleased to be joined by Mayor Bent. Thank you so much, Mayor Bent, Mayor of Conception Bay South, for joining us this evening. Really thankful that you have connected us again with the community.
Yeah, absolutely. It's great to be here, and thank you everyone for joining in. In Conception Bay South, the radon concern is something we've taken very seriously, and as many of you have probably heard over the past 3 years, we've been involved in a free test kit program that we partnered with Take Action on Radon for. Even before that, we had invited a speaker on radon to come into our builders forum, which all the major developers in the town get together once a year and talk about their issues. And we wanted to make sure that it was on their radar as they do builds into the future. And of course, I think some of you have probably heard numbers like 29% of homes tested in CBS have shown up above the level. And we, for the past 3 years, have been doing the free test kit program. This year, we upped it to 200 kits. I believe St. John's did 250 this year. And of course, we treat it like most programs that we do with regards to, carbon monoxide detection and fire alarms in the past. We've done, or smoke detectors, we've done programs to raise awareness and to plug everybody into the idea that this is, for the benefit of your safety. And in recent years, we've turned our attention to radon. And we're very pleased to partner with Take Action on Radon to provide these kits at no charge for the first 200. And I believe that you're among them. And you can do, I guess we're going to do some information later, but the pickup is going to start next week in CBS for those on the list. And of course, we encourage all members of the community to, take it upon themselves to get a kit. In the past, we've done it with smoke detectors, but not everybody gets a free smoke detector. We encourage people to take that upon themselves to do so. And having tested my place last year, it's pretty easy. And I know they're going to go, my dog thinks it's pretty easy, but we're going to go through that in a little bit with the experts on it. I'm certainly not one of them. I'm just like you folks. I had to find out if my house tested or not, and found it was pretty easy and pretty simple process and pretty quick turnaround on the results. So we're very pleased with that. So I'll leave it to you guys to carry on with the meeting. And thanks again for joining us this evening.
Wonderful. Thank you so much, Mayor Bent. Also joining me tonight is Dr. Anne-Marie Nickel. She is an epidemiologist with Simon Fraser University. And so she is going to start us off with the health effects. And then, as Mayor Bent mentioned, we will go into the specifics about how to place your test and then go into the details about who gets a test. We do have a lot of interest, both registration list and wait list. And so we'll cover all that information after that. All right, Anne-Marie, take it away.
Thanks, Pam. So just to give you an orientation, I'm going to go over what radon is and its health effects. And again, no question is too strange or too small. And we always learn something new when we do talks with communities because people have lots of great questions. So feel free to fire away at the end of, or put the questions in the chat. Pam will talk a bit more about how to reduce radon levels if they are elevated and then the details. And just to say, I am calling in from the far other side of the country in the Pacific West Coast. It does not look like this behind me today. It's actually raining, which is not a surprise, but it's at least above zero, so we're happy. And we're a community that is proud to unite members from across Canada that encompass the traditional territories of many First Nations, Métis, and Inuit people whose ancestral footsteps and rights extend beyond the colonial boundaries that exist today. So we respectfully honor their people, history, and relationship to the land. And I'm calling in from the unceded territories of the Squamish, Musqueam, and Salish people here on the West Coast. Next, please, Pam. So, radon gas, if you hadn't heard about it before, you are not alone, or you just knew the word and you're like, I don't know what that word means. It sounds bad. You are in good company because less than half of Canadians still know what radon is and what it can do to the body. So, you are now going to be experts in what radon is. And I'm hoping that what you learned tonight you will take into the community, tell your friends, tell your family members, because we really need to increase awareness of this important carcinogen. So radon is the leading cause of lung cancer in non-smokers, and the second leading cause of lung cancer in smokers because there's an interesting relationship between the two exposures. So I work in BC, and so I can't comment on what the cancer rates look like in your province, but what I can say is here, what we're noticing is a lot more non-smoking cancers. Over 30% of people who get diagnosed today in BC will never have smoked cigarettes. They're also younger and they're more likely to be women. And so this is really raising the alarm bells in this province about lung cancer, which has for a long time kind of been stigmatized and dismissed as a disease of smokers. But as we're learning more about radon and other environmental carcinogens, we're realizing that it's not just tobacco, and that unfortunately people could kind of explain it away, but there's a lot more that's needed now to think about diagnostics, screening, and treatment for those non-smoking people that are getting lung cancer. Next, please, Pam. So how do we know that radon causes lung cancer? It's an interesting case, and it actually is a result of many people in Canada, including miners in Newfoundland. A long time ago, sort of in the 60s, 50s, and 60s, people worked in uranium and hard rock mines, fluorspar mines. You may have heard of the one in Newfoundland. And what was clear, and actually particularly interesting, the contribution of folks in Newfoundland was that exposure to radon gas in mines led to the development of lung cancer in healthy working age men. And they were actually able to tease out the gas, particularly because of the contribution of workers in Newfoundland. So your province has played actually a really pivotal role in our understanding of exposure and response. And it is designated as a known human carcinogen because the evidence was incredibly clear that sustained levels over time increased the risk of lung cancer. And as those levels went up, the risk of cancer went up and happened a lot sooner. So Health Canada's crunched some numbers, and they estimate that about 3,000 people die every year in Canada from exposure to radon gas. Next, please. So as I mentioned before, there's something that goes on with tobacco and radon. Those two exposures together, the radiation and the PM 2.5, have a very lethal combination. So over time, what we've learned is that if you have radon gas exposure and you don't smoke, your risk of developing lung cancer is 1 in 20. Now that's pretty high. It's higher than even the risk of getting in a car accident on average. But if you smoke, it's 1 in 3. And that's because there's like a 1-2 punch that happens between the damage that's done by the particulate matter and the radiation at the same time. And just because I know someone's going to ask, what if you live with a smoker or you're a never smoker or you're an ever smoker, you've quit? You are still at elevated risk until about 20 years after you've stopped smoking. So that's when we know that risks come back down from tobacco smoke. So your relationship between radon, if you've already quit smoking, this is the next great thing that you can do to reduce your risk because of this relationship between tobacco and radon. Next, please. So here in BC, our public health physician is really interested in this issue of tobacco and radon. That's in part because we have a very hot spot of our province where there's a lot of radon and there's also a lot of tobacco smoking. So he likes to distribute it out by levels, and I'm going to walk you through this table. So on the left is the radon level, and Health Canada recommends that people start to fix their home over 200 becquerels. But what I'd like to point out is that 100 becquerel is how we measure radon. Under 100 is a fairly low risk of contributing to lung cancer, about 1%. Between 100 and 200, though, the risk does go up a little bit if you don't smoke. It's over 200 that we start to see this increase in risk. However, if you're a smoker, it's a bit different and the magnitude is more significant. So even if you have low levels and you smoke with radon, you can start to see that that risk is like 12 times more for at under 100. So again, this is an important step that people can take to remediate their home. It's again far easier than quitting tobacco, is measuring the radon in your home and reducing that level. So this will help reduce this additional risk of developing lung cancer. And just one more note about lung cancer, it's like pancreatic cancer, it is one of our least survivable cancers in Canada. We're doing a lot better with breast and prostate, but what we know clearly is that lung cancer is the leading cause of cancer death in Canada and contributes to about 25% of all cancer mortality. So it's still taking a significant toll on the population. And that's why anything we can do to reduce exposure is going to be impactful for people's health in the future. So how do you get exposed to radon? I'm sure nobody here on the call works in an underground mine anymore. It's because radon is a soil gas. And over time, it likes to migrate from cold, crowded places up into warm, more open places because that's just gases doing what they do. So it can migrate into homes through cracks in floors or walls, or sumps, or around pipes, spaces around drains. So any kind of structure that's built that has ground contact, whether or not it has a slab or a basement, is eligible for the radon gas to come in. And generally, levels are higher in those basement or ground contact floors, but we have seen elevated levels like in provinces such as Nova Scotia, even in second floor apartments as well. So where is radon a concern? Interestingly, if you were a miner, you'd be much more protected from radon than anybody else because now we have clear health and safety regulations for people who work underground. However, we don't have the same for homes or even schools. So any building that has ground contact potential, homes, schools, workplaces, is eligible to have radon inside, unless maybe it's a barn that has an open space to it. So if you've got four walls, windows and doors, and a roof, this is the space in which radon can build up over time. So Health Canada recommends that all buildings be tested for radon. And how do you test for radon? So it's a colorless, odorless, tasteless radioactive gas. So you really can't judge how much you have in your home. In fact, your neighbor's home could have high levels and yours may not, because everybody's home is a little bit different. People may have done renovations for energy efficiency. What we know that does is it tightens a home up. That's what it's called, tightening up your home. But what that does is it prevents things that are inside from going outside. So retrofits, renovations, that can change the way the air moves in a house. If you have a finished basement, that will impact how the air moves in your house. And if you have a heat pump versus a forced air furnace, this can also influence levels too. So many different things mean that everybody needs to test their own house so they can figure out whether or not the radon levels are elevated. Next, please. And in this program, you're going to test your house for 91 days. So the kit that we provided you is a very accurate device, and it lives in your home with you and breathes the same air that you do for 91 days. And the reason that we do that is because it's a gas, and gases ebb and flow with time. As things warm up, the levels can be elevated. As things cool down, it can drop down. So what we don't want to do is find out where the radon is the worst in your house, and we don't want to find out where it's the lowest in your house. We want to make sure we find the average. And that's in part because those health statistics are based on average exposure. So about 3 months is what we need with the devices we're going to provide to you tonight to determine what your average exposure actually is. So the detectors that we use in this program are called alpha trackers or alpha track devices. They are made out of plastic. They're fairly durable. There's nothing to break. They don't have batteries. They don't need to be turned on. You need to take them out of the plastic bag. And again, you put them in a place where you spend at least 4 hours. And Pam's going to talk a bit more about that. But they're actually the most accurate type of testing device. You can buy fancy detectors like this. In fact, you probably have these, or some parts of Newfoundland have these in your library. They're about $180 or up. And you can use those to measure your home. They're fairly accurate. But these devices are actually the most accurate way of testing whether or not radon is your home. And Pam will explain that there's a quality assurance protocol to make sure that the devices all work properly. And people in this program will be part of that. So that's just our QC/QA to make sure that the devices are doing what they're supposed to do. Next, please. So what is that guideline level? As I mentioned before in that table where the text turned from green to red, is that in Canada, they've recommended that people take action to reduce levels when it's above 200 becquerels per meters cubed. And I would just like to flag that other countries use different metrics. So the United States uses a picocurie. So if you're getting information from the US, just recognize that the metric is very different for how they measure radon versus what we do. Anything over 200, they really recommend that you take steps to reduce your radon level within a year. It's not immediately dangerous to life and health. It's not like carbon monoxide, it's a different kind of gas, but it's chronic exposure that adds up to lung damage. So it's really recommended that when your levels are over 200, and again, these tests are quite accurate, so you don't need to test again after you've tested with this program. That device actually does the job. You don't need to hire someone to come in. You've done it yourself, and it's sufficient. If it's over 200, you would want to take action to reduce your radon levels within the year. Next, please. So I'm going to hand it over to Pam now, and she can tell you a bit more about the National Certification Program for mitigators and the nuts and bolts of how to get your test kits.
Perfect. Thanks so much, Anne-Marie. All right, so as Anne-Marie mentioned, you're going to get to test, and then once you test, you will get a radon report. On that report, it will give you the radon level. So if you do need to reduce your radon levels, we encourage you to reduce your levels using a CNRPP professional, mitigation professional. So you can go on to the CNRPP website, check out the list, and we do have a professional in Newfoundland. In fact, we've invited him to join us tonight. So Steve will join us at the Q&A section and answer some questions. But I'm going to just do a quick overview of what the radon mitigation system looks like to just give you a quick summary and then help with sort of prompting or giving you some opportunity for deeper, complicated questions. Okay, so if you do have levels that are high and you want to reduce your radon level, then a radon mitigation system is the most effective way to reduce the levels. And typically this can be installed in any home in one day, and it does reduce even high levels to quite low levels. Now, it involves a pipe and a fan, and it looks really simple. We've got a kind of a mock-up of the system here on the screen. So the pipe provides a pathway for the gas to go from beneath the house up and out, where it discharged to really low levels outside. And so the system then has a fan on it so that it provides a pathway for the gas to move as well as it draws the air with the fan. So it's not meant to suck the air from the ground, but what it is meant to do is just ease the air up and out. So it wants to reverse the pressure. So instead of the air coming up into your home, it chooses or it moves throughout this piping system and out. So it looks really simple, but it does need to be installed properly. Some key things are you want to make sure that the foundation is well sealed. So if there are any openings, sump pits, things like that, you want to make sure those are sealed. Frequently, the floor to wall joint too is an access point of air movement. And so that ideally would be sealed as well. And then it needs to be installed in such a way in a location where it's going to be effective, but then also where the fan needs to be properly sized. So the mitigation professional will do some calculations to determine what size of fan should be installed to ensure that it's working efficiently and it's just the worst case for your home, it's reversing that pressure. Here's a couple pictures. So another key thing on it is there will be a monitor that just monitors whether the fan is working. So there's either a YouTube manometer or an electronic monitor. Those don't tell you if the radon levels are down. They just tell you that the fan is still working. So I tested my home. My levels were high. So I have a mitigation system in my home and I cannot hear the fan. So I'll go and check the YouTube manometer, and mine is just slightly off center. So I can see that it's just moving air. But if I were to unplug the fan, then it just levels off and I can see the YouTube is just even on each side. So here's some ideas of what a mitigation system might look like in a crawl space. So if you do have a crawl space, instead of a concrete floor, we still need to get that well-sealed membrane. So instead of a concrete floor, it would be a polymembrane. And again, this needs to be well sealed around all access points. So around that perimeter, it should be mechanically fastened as well as airtight sealing, and then sealed around any opening points. Now, the building code does also come into play for some homes in the province. So in Newfoundland, some jurisdictions do follow the building code. Other jurisdictions follow and enforce the building code. So some homes may have the radon rough-in included. And so I'll just go over what that includes. It would have a granular layer under the slab, and then a poly liner that would be across the full foundation of the slab of the building or of the home. And then all access points would be sealed. So again, any sump pits or any openings between the conditioned space and the sub-slab space would be well sealed. And then there would be a pipe that is called a rough-in. So that pipe is just there. It would be capped about maybe 12 inches up off the floor, capped, sealed, and properly labeled. And then it goes down into that sub-slab space and ties into that granular layer so that it can be utilized. If you test and have elevated levels, now you could just extend that pipe up and out. So that's how the concept works. It isn't in all homes, and it's only been in play for a few years in certain regions of the province. Now, if you do have elevated radon and you do need to mitigate, we do have a grant program in play across the country. So the Lungs Matter Radon Mitigation Grant is a grant that is targeted for anyone who has or is in the moderate to low income bracket. So you can go on the Canadian Lung Association's website, find their criteria, and reduce the levels to below, and apply if your finances are below that median income. In order to apply for the grant, you need a copy of the radon test report. So you do need to test for a minimum 91 days, either with a device like we're using in this program, a one-use alpha track, or if someone else is applying and they've used an electronic radon monitor, they do need an official report, and they do need to test for at least 91 days. And so there are ways to get reports from those monitors as well. And then in addition, you do need a quote from a CNRP professional, and then you need to apply prior to getting the work done. So you need to apply and get confirmation that your application has been approved before you start the work. I will just mention that in Manitoba, there is a loan program. So we also often get questions about financial support. And so in Manitoba, there is a provincial hydro, similar to in Newfoundland, that so it covers the balance of the province. It has a funding program already for energy efficiency measures, and we've been able to include radon mitigation in that funding program, and it would just include then you can get the loan and then apply on your bill to pay it off monthly. It is not available in Newfoundland, but we certainly will be reaching out to the utility to suggest that. So I thought I'd just let you know what else is available in case you're interested in sharing that information with your utility, and maybe we can get some movement there as well. Okay, so that's kind of the basics of the health and testing for radon and mitigation, but I will go into some details about the 100 Test Kit Challenge. So there's 5 easy steps. First step is you can go in and pick up your detector. And so I will give you kind of a little bit more details about that. And then once you get the detector, we encourage you to open it up as soon as possible. You will notice on the envelope, there's an open by date near the top, and then there's a serial number. When you pick up the detector, we want you to record the serial number next to your name. So the pickup locations should have a registration list with a list of people that have pre-registered. So just write your serial number from the envelope on that list. Then the start by date is sort of like a last minute start date. So take it home, set it up right away. But at the bottom, you'll see that we have a 1 week collection, and I'll talk about those dates in a minute. During the collection week, we encourage you to bring the detector back. You can start the detector anytime because you can test for longer than 91 days. But we want to make sure you at least get that minimum 91 days in before the collection week, because if you return it during the collection week, you don't have to pay for the shipping. So that's kind of to orient you to the envelope. So I'll go kind of step by step through this. So when you pick up the envelope and bring it home, inside the envelope is the instructions as well as the detector. So take out the detector. It's in a sealed clear plastic package. So cut open that clear plastic package, take out the black detector, and put that in your home. Now, I want you to picture your home and think about your basement. So if you have a room in your basement where you spend 4 hours a day or more, maybe it's a bedroom, maybe it's a home office or a family gaming room, maybe. Then pick a shelf or a table in that space, and you're going to leave that for 3 months. If you don't use your basement for 4 hours a day or more, maybe nobody lives down there, or you just use it for laundry or storage, then think about a room on your main floor. So again, a room with a home office or a bedroom or a family room, and pick up a table or a shelf in that space. And so the key is you want to measure the radon that you're being exposed to. So like Anne-Marie said, we want it to kind of have the same air that you're breathing. So set it up in that location for the 3 months. You also want to choose a location where it's going to stick around for 3 months. So if you've got kids or pets, then you may want to choose up and put it up on a shelf a little bit higher. You can also hang the detector. So if you can choose an interior wall and hang it on the wall, or you can hang it down from the ceiling. So that might be helpful too if you're moving things around or you've got lots of people in the house. The key is pick a location in where you're breathing the air 4 hours a day or more in your home. Put it up on a table. So don't put it on the floor, put it up on a table or a shelf, and then keep it at least 1 meter away from the window and the location where it'll be for 3 months. Okay, so that's some information for setting it up. Once you choose the location, then we encourage you to go and click the Start Survey. There on the envelope, there's a QR code, so you can scan that. In the email, we give you a link. You can click that, or we give you the link on the envelope as well. You can type it. So there's lots of ways you can find this. But in order to give you a report, we need to connect the serial number that's on your device with your name, contact information, and your location. So we have a number of, because this is so important, we have a number of different ways to make sure that you provide that information for us. On the envelope, the serial number is on the envelope, and then we also have a spot where you can record the start and end date. So I recommend that you go on the computer and you record it, and then you hand write the start date on the envelope. And then at the end of the time, there's an end survey, so you'll complete that as well. And you can handwrite the end date on your envelope as well. Keep the envelope for your records until you get the report, just in case something goes awry and we don't get that information. The serial number, the start and the end date are things that you won't remember later, so you need to make note of those and keep that envelope. All the other information we need to connect you to the serial number. So if you can complete the online survey, that'll help us connect you to the serial number, because that's the only way that we will know that it's yours. So on the START survey, there's mandatory fields, like I mentioned. There are also some optional fields. So we are doing a little bit of research. You can continue on and complete those optional fields if you'd like. But there will be a question that sort of says, do you want to keep going? And you can answer that yes or no, doesn't matter. But that'll be on the form. Now, 10% of you will receive a duplicate detector. And so, as Anne-Marie said, we do research on these devices to make sure that they are accurate. This is to help us make sure that they are precise or they're measuring consistently. And so for those of you that receive a second detector, you'll have 2 serial numbers on the envelope, and you'll have 2 detectors inside. Please open those up at the same time and put them side by side. So right together on a shelf, and start them at the same time. And then when you go in to complete the start form, there is a second place for a serial number. So you can put those together in that form. If you only received one kit, great. You'll just have to fill in one serial number. But if you do get two, please open them together, set them up side by side, and then record the start date together. Okay, so that's starting the kit. Then you got 3 months to enjoy life and the holidays. And at the end of that 3 month period, there is a date on the envelope in March that we will get you to return the detector. So for a 1 week period, there will be a box at your collection points that you can drop it off. And at the same time, we need you to complete that end survey. And so there is information on the end survey. We'll need your end date, and then there is some optional questions there. So we'll go on and get you to fill that out. Again, if you drop the detector off, make sure you keep the envelope and you'll have the serial number. Otherwise, you want to make sure you do that survey before you drop the detector off. Okay, then we will ship the detectors to the lab so that they are analyzed. And then when the lab analyzes the detectors, they will provide you with a report. And this report is kept confidential with you, so we will make sure it gets emailed to you. But what we do is we summarize the results. So we take the data and we summarize it into a community report. And so here is the most recent version of the community report for both St. John's and Conception Bay South. And so you can see on the summary report, we provide information about how many homes that we've tested in the community, so how many data points we have, how many are in the different categories, so what percentage are under 100, those are the green homes, between 1 and 200, those are the yellow, and above 200, those are in the red. And so you can check these out on our Take Action on Radon website. Just go to your provincial page and you can see all the reports that we've done across your province and across the Atlantic, or check out another region and see the reports that we've been doing there. All right, now one thing to note is we do find that emails don't go through as they used to. So we do recommend that you add our takeactiononradon.ca email to your safe sender list. So we will send you email reminders about all these different steps at info@takeactiononradon.ca. And so if you can either just send us a quick hi and that will add us into your safe senders list, or you can manually go and make sure that you add us into your safe sender list. And then that way you should receive the emails from us for the next steps. Okay, so again, that's kind of the summary of how to participate in the program once you get the kit. Feel free to ask any questions about that. But now for picking up the kit. So if you have registered for the program, you may have got an automated email saying you've registered. If you are in Conception Bay South, we sent you an email today that said you are registered, and so you can go and pick up the kits. I think it said starting tomorrow, but I've got some corrected information. So the team at the town office are actually just getting them sorted out. So we ask that you wait and pick them up starting Monday. So you can go in on Monday, and then all next week you can pick up the kits. If you are on the wait list, we sent you an email saying you're on the wait list. We will let you know if there's kits left. And so from the first week are the people that were able to register for the kits. And then after that, we will let the wait list know if there's kits left. And then the same process for St. John's. So if you are in St. John's, you will get an email. So they just opened the program today, and so we're just sorting the list. So we will send you an email with confirmation that you are on the registered list. You will also be in a certain ward. So you registered for your ward to pick it up. And so we will put in that email where you registered. So you are going to go and pick it up from that location. And we will also give you details about the timing of when you can go and pick it up in that email as well. Okay, and then I will I think Edmundo, I think you've been in the audience, so feel free to jump and join us in the panelist invite if you want to give some instructions. Mayor Bent, I don't know if you have any extra instructions for Conception Bay South when they go to pick up their kits.
Yeah, so the kits will be available starting next week, December the 1st. Can't believe it's December next week. So Monday through Friday of next week, you can pick them up anytime at the town hall, 11 Remembrance Square. between 8 a.m. and 4:30 p.m. And if you need to arrange for pickup outside those times, you can contact our office, and I'll give you the number. It's 834-6500. So an extension 401. So if you contact 834-6500 and the extension's 401 between 8 a.m. and 4:30 p.m., they can set it up so that you can pick up your kit outside those hours next week. If you want an email to discuss the pickup, it's simple, but it's long. It's planning at Conception Bay South, all spelled out, .ca. So planning at Conception Bay South.ca, and you can ask some questions or make arrangements with them to pick up your kit outside those times. So starting Monday, December 1st, right through the 5th next week, anytime 8 a.m. to 4:30 p.m. at Town Hall, you can get your kit. And just go to the main desk and tell them what you're looking for. They'll get you set up.
Perfect. Perfect. Thank you so much, Mayor Bent. Edmundo, do you have some instructions for those in St. John's?
Yeah, so everybody who registered, thank you very much for the interest. We actually went through the entire list of registrations in about 10 minutes. So we're just in the process of sorting through that. We'll review your preferred location. We'll sort through the sensors and get them to those centers. And then once we know that they're all in the respective centers, then we'll send you an email or a message via your preference that you identified through the registration for you to come and pick it up. If anybody doesn't pick up theirs, we'll give it a period of time. And after that, we'll basically put it back into the pool, and then we'll contact people in the wait list to come and pick up whatever is left. The total for this year is 200 that we're distributing. Last year we had 500 available, and the intention is to distribute them as evenly as possible across the various wards of the city. So thank you very much for your patience, everybody, and yeah, thank you for participating as well.
Perfect. Okay, so Edmundo, just to remind people, they can come in to pick up the kits starting which day?
We have to get the kits. We're going to get first the kits out to the different the different centers, and then we'll establish the specific dates.
Okay.
So if it's okay, it'll probably be the second week of December at the latest. So keep an eye out for your email just for the confirmation of exactly what dates for the various centers. One thing I'll also add was if you're looking for funding for the remediation, the city partnered with a local industry association for a program called Make the Shift NL and .ca, and the financing available for energy retrofits, it's also available to support radon mitigation, as long as it's no more than, I would say, as long as the component of the project that it's not energy efficiency specifically related, it's less than 30% of the total. So if you're doing siding, windows, doors, and as you mentioned before, tightening up the envelope, there's an opportunity there to mitigate radon at the same time. So the program is live and is currently available, and people can access it via the website that I just mentioned.
Wonderful. Okay, great. Thanks so much for that. So we will email out those details to everybody in St. John's. And then once we hear from Edmundo that the kits are ready, we will send you an email saying, okay, you can go and pick it up and let you know what your window is. Good. And then again, if you're in Conception Bay South, you can pick those up starting Monday, December 5th. Okay, so that's pick up. When it comes to dropping it off, you can drop it off during the week of March 23rd to 27th. If you pick it up from a certain ward, you can drop it off at any ward. So it doesn't matter. Their kits are all the same. In fact, even if there's a little bit of shift between Conception Bay and St. John's, no worries. We track the data. We know where the kits come from. We pay for the shipping back. So as long as you do it in that week, it doesn't matter where you drop it off. But we will, if you do miss that week drop off, then you can mail it back to us, and there is instructions on it, or you can contact us if you have any information. So, maybe you're going on holidays that week and it's not going to be a great week. Don't worry about it. So set up your kit. You can mail it back to us. No problem. It's like a $3 stamp. So these detectors are really easy to mail back. All right, and just before we move to questions, so feel free to throw your questions in there. I'll just do a couple announcements. November is is Radon Action Month, and so we are encouraging you to help us with radon awareness. And so we have a contest at Take Action on Radon to get you some prizes. So if you tell somebody about radon, then you can enter this contest. So the idea is that you would learn something and then you share what you know and enter our November contest. And we're using a play on the word November. So go to knowvembr.ca and take a picture that represents how you shared the information. We've had some very creative entries from people taking various pictures that represents how they shared the information and upload that and then enter the contest. We're coming to the end of the month, but there's still time to get in on it. We have some great grand prizes left, stand-up paddleboard, a KitchenAid stand mixer, a Fitbit, and some gift cards. So get in and enter that contest, and then you can just help us with sharing radon information out. There is also a radon game, so you can go on and play the radon game, learn about radon in other buildings in your community, and also you can use that to enter the contest, so check that out. All right, and we are very thankful. So thankful to Mayor Bent. This project is something that we run for free with so many communities, but your communities have funded it. So they are taking it seriously. They've repeated it again in it. And so we are really thankful for that partnership, that we can work together with them and get a cost at our cost. So we just charge the cost per kit. We cover the administrative costs under our national grant that's funded by Health Canada. So it's a great way to be able to partner with your community to get radon awareness out there and then to help with some free kits. So we know we don't have enough kits for everybody, but the idea is to help out and get some awareness. So if you didn't have a chance to get a free kit, we did invite anybody to join us to learn tonight, and you can go on to the Take Action on Radon website and find a place to purchase a kit. But we are really thankful to the communities. So the Conception Bay South team, Corey and Maggie, thank you for your support. And then, of course, Edmundo, you and your team that you have at all the wards helping support the handout and the distribution as well. Okay, so it looks like we got a good lineup of questions. So Steve, I'm going to get you to jump on and help us with some of these questions. Anne-Marie, have you found some that we should start with?
Yes. Someone had asked if they tested the schools, and Health Canada and the Newfoundland English School Board had randomly tested schools in 2018, 17, 18. I looked, and according to a report, about 33 of those, I don't know what the total percent was, but they did find some schools with quite high levels and some with moderately high levels, and apparently remediation was started and may still be ongoing. If you have children in the public school system, you're able to ask. It's a reasonable question to ask if the school has been tested for radon, and if so, what the levels were, and if it's been remediated, that they're supposed to be responsive to parents. So that's what I can add to that. Pam, are the tests animal safe?
Oh,
What
good
happens
question.
if a dog gets into it?
Okay, yeah. So we do not recommend you putting them in a place where the dogs can get. We have received kits back chewed up, and we cannot get a result for you. So they are not animals. The kits are not safe from animals, but they will not hurt your pet. So if your pet happens to get hold of them, there's nothing toxic in them that would harm them, other than they're made of plastic, so they're not meant to be chewed. Yeah, so we don't recommend them chewing them, but if your kids play with them, or the cat bats it around or whatever, there's nothing in it that's going to spill or whatever.
Here's a question. And I don't know who would like to answer this, but what is the average cost of remediation? And I'm going to guess for Newfoundland, it's different in BC, so I will leave it to Pam
Yeah,
or perhaps local
maybe
folks to talk about this. Sure.
I'll start with this, and then Steve can add on. But we typically have an average of 3,000 that we've seen across the country, and I think it's similar across the province. It does increase with the complexity of the house, so a crawl space may increase the price, and then the complex house may also increase the price. Steve, did you want to jump in on that one? It's a big one to start with.
I was looking at our data, and I'd say 80% of the homes that we mitigate, we could do 80% of the homes for 3,000 or less. So we're coming in a little bit less probably than the national average.
Yeah, sounds good.
Just to add some context to the school question, it's my understanding that all the schools have now been tested
Right.
that have been mitigated. So I've received an email from a government official saying that they've all been tested and where required mitigated. I think there's one exception to that, but essentially all of them.
Yeah. Actually, Newfoundland has been quite proactive with schools, and then also social housing is being tested too. So I know there is an initiative. I'm not sure where they're at with the percentage of those, but I do know that's in the
very, very small.
Yeah. Okay. That is being done.
We could take a page from your book because in BC we have not managed to test all our schools. So congratulations on that. That's really important.
There was a couple individuals in the education department or the facilities management department that just made it happen. They didn't have a budget. They didn't get any fanfare for it. They just went out and made it happen with the resources that they had available to them and got it done. So kudos to them.
Yeah.
Wow.
Yeah, kudos.
Yeah.
Just a quick, if I can jump in, just a quick comment. In the slides, you mentioned the address shown for the pickup at the Muse Center, show the address of the old Muse Center.
Oh, yeah, okay.
All the pickups in the PSA from the city and all the emails that you'll get moving forward, all the communications will have it's the new Muse Center. The old Muse Center is not currently staffed. So it will be the new Muse Center, and we'll make sure to reflect that when we show the communications to ask you to come and pick it up, just in case there is a recording.
Good. Thanks, Edmundo. Okay, Steve, I have a question for you. If your basement is already finished and you can't access the concrete slab, does it mean you have to tear up the finished walls, floors to install a mitigation system?
Generally, no. Only in extreme cases would you have to go to those levels. So typically we can go through a floor in a laundry room, sometimes a closet or a utility room, and put all the system in there. And we'll do all the science to make sure that that location is going to be appropriate and it's going to work really well. But we usually tuck them away. We're pretty good at making them kind of disappear into the background.
So another couple questions about picking up the kit if you're on holidays or putting the kit if you're on holidays. So if you're not able to pick up the kit until a certain date, then you might want to send a neighbor or a friend to pick it up for you. They just need to go in and let them know who they're picking it up for. Or just wait, and then if there's some on the wait list, let someone else get one that's around. And then if there's a wait list, you can wait and pick it up, or you can contact the community where you've registered and see if they'll hold it for you.
If you contact us with the number or email in CBS, we'll hold it for you for the date you're back. That's not a problem.
Okay, all right, there we go. For those that might be away, so we don't know whether the radon levels will be different in your home when you're away unless you test, and then you can figure it out. But I have seen homes have elevated levels when they've been closed up for people that have been traveling. So if you're gone for a week or two, it's probably not going to make a big difference on your radon level. But if you're gone for longer than that, then I would recommend that you think about maybe either postponing the test till you're back, or making sure you set it up in time so that you can end it and send it away before you travel. So that's my recommendation if you're closing it up.
I have an amazing question.
Oh, okay.
Does anyone know if testing or mitigation affects a household insurance rate?
Steve, do you want to jump in on that one?
Yeah, not that I've seen. I've never had any indication of that. I would like the insurance industry to recognize that we put in a mitigation system and lower maybe premiums on life insurance and those types of things. But no, certainly haven't seen any issues with insurance or anything like that.
Yeah, no,
Oh, but
exactly.
I love this idea that if a mitigated home could have a lower insurance rate, I think that would be fantastic.
Yeah.
Okay, Pam, there's a question. If you have a space in a basement that's only used occasionally, but for more than 4 hours at a time, when it is being used, like a guest room, would you test there or a main floor where most people use it for more than 4 hours?
Yeah, that's kind of a judgment call. So yeah, I'm in the same boat. My son used to sleep in our basement. He moved out, so now that's a guest room. But I like having guests, so I would still test there because my heating isn't any different. So the airflow is the same. And so I would probably still consider putting it in either the guest room or in a room there. But, if you've turned off the heat or you're not using it, then I mean the idea is to test what you're exposed to. So then you would test on the main floor. Yeah. Steve, do you have anything different
Yeah,
on that?
most of our customers err on the side of caution and would test if there's any discussion between the levels, then generally we err towards the lower level. The other question that comes up all the time, and maybe Dr. Nicole, you could help with this, is a lot of people have gyms in their home
Yeah.
in the basement. So they're down there, they're working out hard, their respiratory rates are higher. So even though they're only there for an hour or 2 hours a day, when they're there, they're
Wow.
working really hard. So in those cases, we typically err to test in the basement. Would you agree with that?
I would agree with that. Anytime you have increased respiration, that means you're increasing your exposure and increasing the dose. So yeah, if I had a home gym personally, that's where I would test. Yeah. An hour a day, I'm impressed. If people can go down there and work out an hour a day, that's pretty amazing. So yeah, you'd want to test that spot.
Okay, quick one. The last weekly draw for our November prize was November 24th, but we still have the grand prize. So you have up until November 30th to still get in because we still have some draws left. So good news on that. All right. And
How did
oh,
the heating sources, did you see that just came in?
okay, nope, I haven't seen that one. Do you want to read
Okay,
it?
sure. How do various types of heat sources affect radon levels?
Well, I'll answer my thoughts and then Steve, you can maybe add to this. But there was research that was done in about the 80s, and the bulk of the homes that research was done in was radiated heat. So that research showed, on average, the highest radon level was in the basement. I think it was 60% of the basement level was the main floor level, and then 40% was the second floor. So that's on average from the research, but this was radiated heat. So for those that use, baseboard heat, in-floor heating, where there isn't a forced air movement, you may have some leveling. It doesn't mean that their radon levels can't be elevated on the upper floors. It just means it might not be as high as it is in the basement. But in a home where the air is moved around, circulated, it is usually fairly uniform. So we are seeing even levels. Steve, you any thoughts on that?
Yeah, we see something similar. If you have a forced air system where it's churning the air up, generally pretty close, plus or minus 20%, the same levels between the basement and the main levels. So in Newfoundland, we have a lot of electric baseboard heat. So in those, you'll see kind of more of a stratification, I guess. So the levels on the main level won't be quite as high as the basement.
Yeah, good. Um, there's a couple questions about where to get kits. So if you go on the Take Action on Radon website, you can find a list of providers. The cost is about $60. There are also electronic radon monitors available. So those are about 200. I think they're on sale right now for maybe 175. Yeah, Anne Marie's got a picture of one of them. And so you can take a look at those electronic monitors. November is a good time. They tend to go on sale.
They sell them in Conception Bay South at Home Hardware and Kent's, and they may
Good.
have them somewhere else now.
Nice. Perfect. Good. So then you can go and get it locally. Good.
And I think somebody asked a question about what are my chances of getting one if I'm 61st on the wait list. If you're in CVS, probably slim to nil. We find that most all of the kits are picked up. unfortunately, I think that not all the kits are sent back. But if I could just throw a plug in for that, is if you get a kit, please use it and please send it back, because it all depends on getting the kit back and the results. And if we do 200 kits and they're all picked up and only 130 of them are actually used, then there's 65 out there that could have been used. So make sure, please, that you do use them. But yeah, if you're 61st on the list in CBS, where we've done 200 kits, I think Edmundo said that St. John's did 200. I thought they might have done 250, but otherwise, when you're that far back on the list, it's pretty well you're not going to get one. I think we had a few left over the year before last, and then they went right away to the next people on the list. So, then I may have been 10 or 12 that were left over.
Yeah, good. Thanks so much, Mirabent. Okay, a couple more quick questions here. If you have an apartment, so I think I'll just expand this question because we do get various versions. So if you have a nanny suite in your house, where they keep the door closed all the time, that's one question we often get. If you have a duplex, so think about the ground contact units. So again, whatever kind of their various variations of this, if you're trying to choose one location in your home or your duplex, think about the ground contact floor first and then test in those. I have tested in a nanny unit where the door was closed all the time, but it wasn't like an exterior door. It was just an interior door. The levels were even in the basement. So typically one test is enough. But if you live in an apartment and you're not in the ground contact floor, you can still test. So this, you can be open. It should be lower if you're not in the ground contact floor, but we have seen upper levels high. If you want to, you can contact the building owner. We do recommend you do that anyways. Let them know that you're testing. And we would recommend a building be tested from the ground up. So the contract floor of the building would be tested, so that when we're thinking about testing from the unit, that's how we do it, or from the building, that's how we do it. But since you may just be an occupant and don't have control over the other units, go ahead and test your own unit. Anne-Marie, any other questions?
Fascinating question from Jenna. Thank you. And I don't know the answer to this, and now I want to go study it. She asked if you should keep the detector away from an Airglade air freshener or an air warmer, an air wick warmer. So my gut response is yes. That is generating PM 2.5 in aerosols, which in some ways might influence the radon levels. But I can't say with 100% accuracy that is true. But personally, I would keep it away from that device. But now I'm fascinated by the impact of something that generates aerosols that would be nearby. So Jenna, I would err on the side of caution and maybe put it across the room, but now I want to get a student on this project. So thank you for inspiring me.
There you go. So we have done some of that testing though. We put detectors all over the room and found that actually it doesn't matter if you put it up or down or in the middle. So there is a lot of flexibility with where you put the kit. We do recommend if you have a wood stove, just to keep it a little bit away from the wood stove. Obviously it would melt, but also it, just a different heat if it's too close. If you've got a fireplace that's a stone fireplace, we recommend not putting it on the stone fireplace. Rarely, but sometimes there is some background interference, so just put it on some other location. Don't put it on the floor. Also, concrete can give some background emanation. Otherwise, it is fairly flexible. Oh, another question that we often get, what I thought you were going, is air filters. So air filters do not filter the radon out. It is inert. It flows right through filters, so it won't stop it.
Yeah, there's a fireplace mantle, propane fireplace mantle, Pam. Would you put it there? Probably not. No, because there's it's
maybe
air.
just put them
hot. It'll melt.
Yeah, exactly. All right, we are going a little bit over the hour, but we do have some questions. So if you guys are good, we'll just do a couple more. Steve, there is a question about having an HRV running. Does that help mitigate the radon?
Maybe. So if it's installed correctly and if it's maintained correctly, it does bring in some fresh air and move some air out. So the net impact is that you're diluting the radon in the house a little bit. Generally, I don't see a big impact, But where we do see a big impact with HRVs is if they're installed incorrectly or they're not maintained, they can create a pressure imbalance inside the home. And then that HRV turns into a radon mining machine and just absolutely maximizes the amount of radon that can come into the house and drive the levels way up. So when we come in to do a mitigation, we'll test for those pressures. And lots of times we have to tell the homeowner, hey, your HRV needs to be rebalanced, or the filters need to be cleaned, replaced. Yeah, they can be brutal if they're not maintained.
Yeah, good. And so you might want an electronic monitor for those. Slab on grade house, yes, still test even if you don't have a basement. Any building that's on contact with the ground, slab on grade, mobile home, you could still have radon. I'm in the middle of renovations. Steve, should they test now or at the end of renovations? What do you think?
Absolutely during the renovation. Well, preferably before the renovation, but now that you're already into it, yeah, my recommendation would be a digital detector, because that's going to start giving you some data earlier. Typically, what I find is that you started the renovation, you want to keep moving with the renovation, with the little pucks that are part of the program, the free pucks. Those take 3 months after you get it, and then there might be a month or 6 weeks after before you get your results. So it's about a 4-month process to 5 months process. So the digital detectors, which are $180, would start giving you data much quicker, and help make a decision earlier if you want to mitigate or not as a part of your renovation.
Great.
It'll also tell you if you change something during the renovation that has impacted the radon levels negatively.
Perfect. Anne-Marie, here's a question for you. What are some of the symptoms of radon gas in my house? And does the gas move from one house to another?
Wow. Okay, I'm going to answer the first question. Maybe you could answer the second question. So some of the symptoms of radon gas exposure, there's no real symptoms of the gas exposure itself. It's not like carbon monoxide where you'd start to fall asleep, which is, just to be clear, carbon monoxide is a very dangerous gas. So everybody needs to have a detector in their home for sure. I think in BC it's required to everyone home have a carbon monoxide detector. But for the symptoms of lung cancer are often difficult to ascertain, especially if people aren't smokers. So if you have a cough and persistent cough and back pain with unexplained sources, like you didn't hurt your back at work and you don't have COPD, I would talk to your doctor about it, especially if you have an elevated radon test. I would go to your doctor, give them the information, and talk about your symptoms. Particularly in non-smokers, those two symptoms together can be ignored. And it's important. Early detection is the way that it improves survivability of lung cancer. So unexplained, persistent cough and back pain together are kind of the hallmark of underdiagnosed lung cancer. So that's all that we know so far. Radon gas itself doesn't cause irritation or anything. It's an inert, noble gas. It passes through all filters or air purifiers. They can't capture it. It's its own unique sort of thing that doesn't interact with anything except when it decays, it gives off radiation. So it doesn't, there's been a bunch of questions about air filters too. So they don't filter it out either.
Yeah. Perfect. And a good question about mitigation. So yeah, once you mitigate, and this is actually a really important point, once you mitigate, you will need to do follow-up testing. So a CNORT professional is responsible to do a short-term test, and then you need to do a long-term mitigation. And I meant to mention that we are doing a survey on post-mitigation. So if you know of somebody that tested previously with us or at all, we do have a post-mitigation survey. And so we will be sending that out in January. So let them know, watch their email in January. And we do have kits available specifically because as you saw in the report, we've been tracking, the red houses are the ones that are above 200, and that helps get us an idea of prevalence in the community. But we also want to show that we're seeing those mitigated and that the actual real levels are coming down. So we're going to be updating those reports to show mitigation levels. We will provide mitigation, post-mitigation kits for those that have been previously part of our studies starting in January. So check for that information if you participated before. And if you did, then maybe you can pull out from the free kits, let them to somebody in the wait room, and let us know, and we'll make sure that we get you on the list for January's kits. Okay, I think I will wrap it up there. I do try and usually keep to the hour. I let us go longer today because there is great interest. So thank you for all of you that stayed. Thank you for the incredible, great interest, and really appreciate that. We will go download the questions, make sure that we have the answers on our FAQs, and then I'll send you the link to the FAQs as well to keep you up to date. So again, thank you to our community representatives, to our participants. Thank you, Mayor Bent and Edmundo, for joining us today, and Steve for helping us with some of those tough questions.
Well, thank you for hosting, and appreciate everybody for joining in. Thank you for your help.
Yeah, and thank you.
Yes, thank you very much.
Perfect, and thank you, Anne-Marie.
All
right.
right. Thank you, Pam. And I'd like to thank Health Canada for their continued support of this program. It really is them that makes the funding available for people to get free test kits. So they're doing what they can to help out with the radon problem across Canada.
All right, here we go. Good. Yep. Thank you. All right. Take care.
Thanks.
Bye.